Welcome back to Dr. Sellars Educate. We're happy that you're back and we're thrilled to continue to support you on your mission towards success. Remember that our mission here is to support you throughout your journey to achieve certification as a nurse educator by the NLN organization. For this specific episode, we will be focusing on our framework of success model. That's right, this is a new model that we are launching right here on our YouTube channel to help nurse educators have a more organized framework around their focus on their journey. Now, if you have not been to our website, you want to go ahead and take a moment right now to do two things. First, go ahead and subscribe to this channel so every single time we launch a new episode, you will be alerted right away. The second thing I want you to do right now is go ahead and head over to our website. That is drsellarseducate.com. That's where you're going to find a number of resources to help support you every single step of the way. There is one consistent barrier to success as reported by the nurse educators that we have supported more than a year now, and that is being focused. Having time, dedicated time to set aside to hone in on those specific knowledge gaps that you have related to every competency is one of the biggest barriers because life happens, right? There are competing priorities that we all have to sort through every single day. So let's get started in looking at our framework. It is in the shape of a triangle. On the bottom level, you will notice that the foundation is experience. Experience is a foundational component of the framework. You want to ensure that you have developed 3+ years of solid academic experience to help you on your journey. Now, if you have less than 3 years of experience, you may be eligible for the CNE novice exam. As always, we recommend that you reach out to the NLN organization if you have any questions about the eligibility criteria and want to clarify whether or not you meet the criteria for each of the certification exams. Second, you want to ensure that you are gathering your resources. We recommend 3 key resources as part of the journey for you. First is going to be the NLN Candidate Handbook. If you haven't been to the website, you want to head over to nln.org, and that's where you're going to see the handbook that's available for you to print out in the PDF format. Our recommendation is that you print it out and that you focus on that detailed exam blueprint. That is going to help you have a better understanding of all the sub-competencies and be the first step in you identifying how you're going to close your gaps in order to be successful. And then the final component of the framework is going to be support. Here at Dr. Sellars Educate, there are different levels of support depending on where you are on your journey. Support could look like coaching. It could look like a review, a group review, or it could also look like a study plan. We recommend some level of all 3 components. This is what's going to help you, again, hone in on any of those gap areas along your journey to ensure that you are successful. If you have concerns about any of these resources or are simply unclear about how much time you need to spend with each of these areas, feel free to reach out to us and we'll be happy to talk to you more. Now, let's talk a little bit more about resources, and let's make sure we capture those here as well. So we talked about the NLN handbook. We also talked about we didn't actually talk about the teaching and nursing textbook. I knew there was a resource I wanted to come back to. All right, but we did talk about Dr. Caputi's review book. I'll go ahead and add a disclaimer. I am not affiliated with any of these resources that I'm recommending, nor am I in partnership with NLN. The mark of professionalism really is all around certification. And so that's what is our driving force behind our mission. We want to ensure that each of these gap areas are closed for you as you continue on your journey. All right, so let's recap. Experience. What you want to do, if you haven't already, go ahead and draw this triangle for yourself, because we're going to break down each of these elements. If you have less than 3 years of experience, we still want you to focus on the competencies now. So go ahead and print out the NLN handbook. Most nurse educators are on this journey 1 to 5 years, some even longer than that. So we don't want you to get discouraged because of where you may be right now. We just want you to stay on track. Again, what is the #1 reason why nurse educators don't achieve success on the certification exam? It's because of lack of focus. Okay, so you want to make sure you stay focused. So experience is going to be this foundation for you. I want you to go ahead and shade in where you are on this scale. So for example, if you are at a point, and you can use a highlighter or you can use a pencil, whatever's easiest. If you have 1 year of experience, you want to shade in 1/3, okay, of this area. And then you can scale it up to, again, help you stay focused. All right, so now let's talk about the other 3 components. Support is the next one. So again, if you have some plan, either for coaching, a review course, we offer 2 options here at Dr. Sellars Educate. You have the availability of a live review. Every month we offer the Academic Nurse Educator live review, and you can also receive 4 credit hours. Check out our website, Dr. Sellars Educate, if you want to find out the dates. And the other option is a self-paced review course. That is offered for our CNE, the academic, or the CNE clinical, as well as the CNE novice. Okay, so we recommend, again, this framework for success. A key important element is going to be a review course. And let's go back to the coaching. Now, there are 3 different ways you can receive coaching. One is going to be through mentoring. That's always a great resource. So right there at your university, you can identify someone who has been successful on the CNE to help you and serve as your mentor. All right, the second option is through one-on-one private coaching with Dr. Sellars Educate. And then the third option is what we call our boot camp. So every month we have a boot camp where we focus on key competency areas for the certification exam. So we have one for the CNE novice nurse educators that are on that journey. We encourage you to join that one. Or for the CNE clinical, we have one separate for you all to focus on your competencies as well. So that's coaching. So we have the coaching segment, and we have the review segment. And then our third segment is the study plan. And you probably think, oh, the study plan sounds simple. Well, it does until you get off track and you're not sure where you left off, or you simply become frustrated in reviewing the content. So I want you to go ahead and shade wherever you are for each of these 3 areas of support. If you have already outlined your coaching plan, awesome. What you want to do is go ahead and shade that. If you've completed your review, or at least identified where your review is going to come from, you want to go ahead and shade part of that. And as soon as you complete that review, you can fully shade that area. All right. And then this third component is the study plan. Here at Dr. Sellars Educate, we recommend anywhere from 3 months to 6 months for a study plan, focusing on one competency per week for the CNE, as well as for the CNE novice and the CNE clinical. Now, you might ask, what if I get completed with the content in less than a week? We still want you to focus on 1 week. If you have additional time left, and that's usually 8 to 12 hours per week per competency, if you want more specific information, feel free to head over to our website and you will find a study workbook for the CNE novice, and the CNE clinical that's going to give you more detailed information about exactly how many hours we recommend. All of these points, all of this information really is aligned with success that we have seen in the nurse educators that we support, as well as recommendation from the literature sources that are recommended by the NLN organization and in their references as well. So even though you may not see in the literature a specific amount of time per competency, what we do know is that there are specific sub-competency areas that we want you to hone in on, and there is a set amount of content that's included for each of those sub-competency or sub-content areas. Okay, so that's how we quantify the number of hours that are recommended per competency. All right, so just to recap, you have now two different components of the model or the framework that we've discussed. Experience, we recommend 3+ years. This section you are going to highlight until you get to a minimum of 3 years. If you have less than 3 years, don't get discouraged. Remember, you're going to go over to the NLN website and look up information about the CNE novice exam to see if you qualify. The second component of our framework is going to be support. That's going to come in three different ways or 3 different levels, which is going to be coaching, review, and study plan. All right, and our last element that we want to break down a little bit further is going to be the resources that we just talked about earlier. So you have Dr. Caputi's review book, you have the NLN handbook, and then you have teaching and nursing. If you are on the journey to complete the clinical exam, we recommend teaching and nursing as well as an additional resource that you may or may not be familiar with. So I'm going to go ahead and show it to you all. And this is the Clinical Nurse Educator Competency by Teresa Shellenbarger. Okay, so I'm going to go ahead and put over here for you. I'm just going to put CNE clinical. Okay, I'm going to put a plus. So for those of you that are on the journey to complete the CNE clinical, you will know what that means. So same thing as what we did over here with the support segment of our framework. Once you have purchased Dr. Caputi's review book, you want to at least shade it in half. And then once you review all of the content areas in her review book, that's when you can completely shade it. And then for the NLN handbook, same thing. And then our final resources are going to be our textbooks. All right, and then hopefully over time, you would have shaded all of your areas, right? And that's going to, and I'm sorry, that should be one whole area. And once you have shaded all of your areas, this is going to indicate to you that you are now ready to sit for the certification exam. All right, that's it. Hopefully that makes sense to you. If not, we are always here to support you. Feel free to reach out to us via email. That is info@drsellarseducate.com or drsellarseducate@gmail.com. We hope this has been helpful, and we look forward to seeing you next time as you continue on your journey.